Assalamualaikum.
وعليكم السلام.
وعليكم السلام.
How are you guys?
الحمد لله.
Fine, sir.
Okay, I'm happy to start a new batch. And we will start by Socrates, history taking. Again, just to remind you, the introduction last session, very, very important. Once you feel you're confused, just to go to the introduction. It will show you everything. So we will start by history taking. Stations number 1, 2, 3, and number 10. So it could be adult history or pediatric or psychiatry or toxicology. History taking will take like 5 sessions. Psychiatry toxicology history taking will take 1 session. Resus 3 sessions. System and joint examination 2 sessions. Practical skills and teaching maybe 3 sessions. Communication maybe 2 sessions. Alhamdulillah, we have the highest scores and we have the highest rate of success. Last session, last batch was for January. They are waiting for the results. The previous one, December, alhamdulillah, more than 95% of success. So this batch for March, if anyone has any exam in June or July or September or November, so you can attend also as listener. It's not a big issue. If you are happy to practice also, it's not a big issue. We are happy to let you to practice. Regarding face-to-face, only 1 seat is available. And next time will be in Hyderabad. It will be 18th March. Just to remind you, you have 5 domains: accuracy, skillfulness, efficiency structure, supportiveness, and safety. Accuracy, checklist. Already we are providing checklist for you. Skillfulness should be fluent. And again, fluent doesn't mean continuous talking. No, even you are silent, no problem. But once you are talking, you are fluent. Efficiency structure, you should be organized. Supportiveness, good communication skills. It means good body language, good attitude in the room, and also good eye contact, empathy, sympathy, check comfortability, check pain, give questions in pieces, information in pieces as well, and you should pause between pieces, check understanding, and so on. Safety, correct information, correct diagnosis or differential diagnosis, correct decisions. So the general approach, I'm talking about the accuracy, general approach for history taking checklist. You have part 1, the slide, and part 2. Part 1, you can fix in any history taking. Part 1, you can fix in any history taking, whatever, adult, pediatric, even in psychiatry. Part 2, also it will be fixed, okay? Part 1 can be modified, very small modification in adult and pediatric, very small modification in psychiatry, okay? So you have 3 open questions, 3 open questions. In any station, you should introduce yourself. This is patient, so good morning, I'm blah, blah, blah. May I know your name and age, please? Then smile, nice to meet you, rapport. How can I help you? The first open question. Oh, sorry to hear that. Show sadness. So when you say nice to meet you, smile. When you say sorry to hear that, show sadness, okay? Then you have 3 approaches. If the station about pain, you will say, are you comfortable? Do you have any pain? If the station no pain, for example, shortness of breath, are you comfortable? Do you have any pain? Do you still have shortness of breath? Like that. Then take consent. Consent, if you want to take consent before the first open question, okay. Before the second open question, also say no problem. Okay. So anytime, no problem. But very early. Try to take very early. Can you tell me more about that? So the second open question. The third open question will be in the end. Would you like to add anything? So you have three open questions. You will repeat the answer of the second open question exactly and completely. So if the actor said one sentence, repeat. If the actor said two sentences, repeat. Even if the actor mentioned 2 minutes, repeat the 2 minutes. Okay. So you said the problem started blah 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 blah. Is that right? You will say yes. Then you can follow your approach. Today we will follow Socrates. Okay. After Socrates, the review of systems. Review of systems. Okay. So we have four parts in the body. We have head, then back and limbs, then chest, then tummy. So four systems. Okay. Head and back and limbs always together. So for example, CNS, musculoskeletal. Chest, it means cardiovascular and respiratory, always together. Tongue, it means GIT, urogenital, and ministerial female. Then dermatology and miscellaneous. Okay. So always start by the most relevant system. If the patient has, for example, headache, start by CNS and musculoskeletal. If the patient has back problem, so start by musculoskeletal and CNS, and so on. Then other systems. What if you ask only the most relevant system? I mean, the patient has headache, and you ask about CNS musculoskeletal only. You did not ask about GIT and the other system. No problem. Don't worry. Okay. But better to ask all systems. Better to ask all systems. Even irrelevant? Yes, even irrelevant. For example, the patient has, I'm talking in general, in real practice, the patient has no headache. Do we need to check the blood pressure? Yes. Sometimes we are doing many things as routine, and you will discover the patient has um, hypertension. We are calling accidental. Okay. So you can find the patient, for example, has heart racing. The patient complain headache. But when you ask about any chest pain, any heart racing, maybe he will say yes. Okay. So even irrelevant, no problem. But what is the most important for the purpose of the exam? Start by the most relevant system. Clear, guys, this point?
Yes.
Yes,
Okay.
sir. Yes, clear.
The second part, you can fix in history, whatever, adult, pediatric, psychiatry, toxicology. So once you finish, once you finish the present, I mean, whatever Socrates or Ibarra or who approach, then you will jump to the second part. Ask by this way, very concise, very simple. Any past medical disease, and stop. Any previous surgery, and stop. Any prescribed medicine, and stop. Any allergy, and stop. Ask closed questions, but not very closed questions. So you can ask any past medical disease and stop. Don't say any blood disease or any liver disease or blah, blah, blah. No need. So make it closed, but not very, very closed. Okay. For example, any allergy. This is very close. Don't say any allergy to medication. No, this is wrong. Why you will ask allergy to medicines only? So any allergy better. So allergy in general, whatever to food, to medications, to cold, to hot, so to anything, to clothes, to latex. Okay. Any disease running in your family, no need to say Any significant disease in your family? Why significant? Why you make very specific? Any disease run in your family? More than enough. Okay. Social, whom do you live with and where do you live? And stop. Do you smoke, drink alcohol, or by any chance do you use any illicit drugs? And stop. What do you do for a living? Then stop. Then, would you like to add anything else? The last open question. Then ask about the concern. Ideally, it should be ICE, means idea, concern, expectation. But do you need to be very ideal? No need. What is your concern? More than enough. Then give the diagnosis if clear, or differential diagnosis if you have more than one possibility, and then the decision, what you will do with the patient. So if you find you code the diagnosis, then you can say, according to your data, the most likely problem is blah, 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 blah. Mention organ. It could be heart, it could be brain, it could be, for example, a heart attack, and so on. But once you mention the problem, show reaction. If the problem is benign, mention it's benign. Or you can say it could be benign. If you find the problem is serious, you can say, I'm sorry, it could be serious. Okay. For example, the patient has heart attack. According to your data, the most likely problem, it could be heart attack and show sadness. And then say, I'm sorry to say that. Okay. If you find the problem is not clear, of course, it's not clear for you, because for sure, all diagnosis will be clear in the exam. So you can say, according to your data, there is no clear cause at the moment. No problem. Don't worry. You can still get 10 out of 10. Then the management plan. So if the patient has complaint relevant to chest, you will follow this management plan. If the patient has complaint relevant to the head or back or limbs, you can mention this management plan. Patient has complaint relevant to tummy, relevant to liver, spleen, gallbladder, bowel, so you will mention this plan. The patient has complaint relevant to tummy, relevant to the kidney, the ureter, the bladder system, then you can mention this plan. Clear until now, guys?
Yes, sir.
Okay.
Yes.
We have for practice Muhammad Omar, then Nagla, then Jivana, then Emmanuel. Okay, if anyone interested, and Ahmed. If anyone interested, you can raise your hand at any time. Today we will practice Socrates. So you will do part one, then Socrates, then review of systems, then part two. Easy. So general approach part one, then Socrates, then review of systems, then part two, then the diagnosis and the management plan. So in Socrates, almost the same as Odebara. So you will ask, where is the pain? Can you point at the pain? When did the pain start? Then ask, sudden or gradual? How would you describe this pain? Is it like stabbing, sharp, tearing? Then ask, does the pain spread anywhere else? If the patient you ask already, does the pain spread anywhere else? If he said yes or no, don't ask any pain in the body, not logic. For example, the patient has chest pain. Patient has chest pain. You ask already, does the pain spread anywhere else, like arm, jaw, back? He said yes or no. Is it logic to ask him any tummy pain?
No.
Oh,
No.
Not logic. Because already you ask him, does this pain spread anywhere else? If he has tummy pain, he will say, yes, the chest pain spread to my tummy. Not logic to ask him any limb pain. Not logic to ask him any headache. Because already you ask him, is this pain spread anywhere else? So in Socrates, don't ask about other parts pain. Okay? One question only for pain. Does the pain spread anywhere else? Then give him examples. And give him examples relevant to the complaint. For example, the patient has chest pain. Logic to ask, is it spread anywhere else? Like arm, jaw, back. This is relevant to chest pain. But what if the patient has headache? You will say like that. Does the pain spread anywhere else, like eye or face? More than enough. Okay. Then time, is it worsening, improving, or the same? Is it continuous or on and off? You should pause. So once you say staying the same, stop. Is it continuous or on and off? Stop. Have you had this problem before? Stop. Then anything cause or worsen it? Stop. Anything improve it? Stop. Any chance you can score your pain from 1 to 10? Then stop. Give him example, 10 being the worst. Then associated symptoms. You will start by the most relevant system. Okay? So as we mentioned in previous session, no need to ask about limb problem. You can ask about CNS musculoskeletal. You want to ask about limb problem in specific cases. For example, if the patient has limb pain, whatever, knee pain, knee swelling, leg pain, leg swelling, like that. So you will ask these questions. I want to ask about ministerial, if female only. Any station of history, any station. Okay. So here regarding the general approach, part 1, Socrates, review of system, then part 2. Okay. Regarding today, stations, throat pain. What is the most relevant systems, guys?
CNS and musculoskeletal.
So the throat here, ask yourself, throat in the head and the neck. Throat in the head and the neck. So you will start by CNS after Socrates, of course. You will start after Socrates, CNS questions, and then musculoskeletal question. What else? The mouth is window for air, water, food. So window for air, it means respiratory and cardiovascular. Window for water, so your genital. Window for food, so GIT. Easy?
Yes.
So number 1, where is the throat? Ask yourself, where is the throat? In the head. So sinus musculoskeletal. What else? So this is window for air, water, food. Okay. Here, headache. What is the most relevant system?
CNS musculoskeletal.
CNS musculoskeletal.
So where is the headache? In the head. Okay. So any complaint, don't care about the complaint itself. I don't care. Care about the site. So the headache where? In the head. So CNS musculoskeletal after Socrates. Chest pain. I don't care about the pain. I care about what?
Chest.
Chest. Chest pain or chest rash or chest lump or chest redness. Clear, guys? So
Yes.
where is the site? In the chest. So what is the most relevant system?
Cardiovascular. Respiratory cardiovascular.
Cardiovascular and respiratory system.
Yes. Abdomen pain. What is the site? Abdomen. So
Abdomen.
So here, ask yourself, if the patient has pain, if the patient has pain in the right upper quadrant, you will start by
GIT.
and
Urogenic.
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 If the pain in the left upper quadrant, say GIT, then urogenic. If the pain in the flank, what is the most relevant system?
Urogenital.
And
And GIT.
and
GIT.
GIT. Excellent. Pelvic pain,
Urogenital.
Urogenital GIT.
urogenital GIT. Testicular pain,
Urogenital GIT.
genitourinary,
أو genitourinary.
genitourinary, and then GIT. Back pain,
Musculoskeletal. sinus.
mus musculoskeletal and sinus. Knee pain,
Musculoskeletal.
musculoskeletal and
Musculoskeletal sinus.
sinus. Leg pain,
Musculoskeletal sinus.
yes. Okay. But knee pain and leg pain, you will start by limb questions first, right?
Yes.
Okay. So we will start the practice. In the exam, you will find 1 minute in front of the door and then 8 minutes inside the room. More than enough to finish. Our candidates, after the exam, they are giving us feedback. They said we finish the station within 5 minutes, maximum 6 minutes. Okay. And they are getting high scores and all. Okay. So
Mm.
don't worry about the time, but it doesn't mean you will be slow. Okay. We will practice 30 seconds online sessions for online practice and then 6 minutes for the station. Okay, guys?
Okay.
Okay, sir.
We will start by first one. Omar,
Yes.
how are you?
Alhamdulillah.
Alhamdulillah. Okay, you have 30 seconds, then 6 minutes.
Okay. Can I start?
You can start.
Okay. Good morning. I'm Dr. Omar, ED registrar. May I know your name and age, please?
I'm
Okay.
Fadi,
Nice
I'm
to
31.
Okay. Nice to meet you, Mr. Fadi. How can I help you today, Mr. Fadi?
I have throat pain, doctor.
Oh, sorry to hear that. Do you still have pain?
It's okay, the nurse gave me painkiller.
Okay. I need to take some data from you, Mr. Fadi, regarding this throat pain. Is that okay with you?
Yes.
Okay. Can you tell me more about this pain, Mr. Fadi?
Yeah, the problem started 1 month ago and started gradual, increasing, worsening. I think it's a continuous.
Okay. So the problem started 1 month ago. It is increasing, gradual, continuous. Is that right?
Yes.
Okay. Can you describe the pain exactly? Where is the pain? Can you point the pain?
In the center.
In the center. Okay. This is the pain. Can you prescribe it? It is like heaviness, like stabbing, sharping,
Sharp.
tearing,
Sharp.
sharp. Does this pain radiating elsewhere?
To the front of my neck.
Front of your neck. Okay. This did you have this pain before this 1 month? This happened
No.
before?
No.
Anything worse in it?
If I'm eating or swallowing.
Yes. Anything improve it?
No.
Any chance you can score your pain from 1 to 10, 10 being the worst?
5.
Okay. Mr. Fadi, did you have any headache,
No.
jerky movement,
No.
vision problem?
No.
Did you lose your conscience before?
No.
Any ear pain or nose pain?
No.
Any numbness, weakness, any trauma?
No.
Any change in bowel habit?
No. But I
Do you feel sick?
I have loose bowel motion in the last 2 weeks.
Lose bowel motion last 2 weeks. Okay, sorry to hear that. Okay. Do you feel sick?
It's okay.
Do you throw up before?
No.
Any yellowish discoloration, a yellow color in your skin or eyes?
No.
Any change in urine?
No.
Any urethral discharge?
No.
Any ulcer or skin changes in your genital area?
No.
Any chest pain?
No.
Any heart racing?
No.
Any dizziness?
No.
Any shortness of breath or cough?
No.
Any noisy breathing?
No.
Any temperature or night sweat?
I don't have temperature, but I feel I cannot tolerate heat, you know.
Yes. Any change in appetite or your weight?
I lost weight like 5 kilograms within 1 month.
Okay, sorry to hear that. Any lump in your body?
In the front of my neck.
Yes. Any past medical history?
No.
Any previous surgery?
No.
Any prescribed medication?
No.
Any allergy?
No.
Any disease around your family?
No.
Mr. Fadi, I will ask you some question. I asked all my patients, whom do you live with?
With my family downtown.
Where do you live? Do you smoke?
No.
Drink drink alcohol?
No.
By any chance use any illicit drugs?
No.
What do you do for a living, Mr. Fadi?
Receptionist.
Okay. Would you like to add anything, Mr. Fadi?
Yeah, sometimes I feel heart racing also and a change in voice.
Okay. Sorry to hear that, Mr. Fadi. What's your concern, Mr. Fadi?
What is the problem, doctor? Is it serious? Do I need any surgery, any admission, any imaging?
Okay, Mr. Fadi, I appreciate your concern. According to your data, the most likely problem is related to a gland in the front of your neck, which is called the medical term thyroid gland. And the symptoms you describe, there is overactivity of this gland. So I need to keep you in observation room. I need to do full examination, including your head, including your back of your eyes and your neck, including also a lymph node in the same area. I will do some blood tests, including this gland hormones, infection screen, inflammatory markers. And according to the finding we can do in the lab investigation and in the examination, we will involve the medical team for further management of your case. It is okay with you, Mr. Fadi?
Okay.
Did you want to add anything?
So I will stay here or I will go home?
Mostly you will stay here until we finishing investigation and examination, and according to the finding, we can decide later if you can need admission or you can discharge home.
Okay, thank you.
Thank you.
Your time done. Okay, what do you think, Omar?
I think the management plan needs some optimization.
Okay, so this patient has throat pain 1 month ago. He has a change in voice, also lump in his front of his neck. He has loose bowel motion, loss of weight, heart racing. So the patient has symptoms of hyperthyroidism, right?
Yes.
Okay, so this patient, the problem started gradual, 1 month, unlikely to be throat infection, right?
Yes.
Throat infection, it will be 2 to 3 days. And
Yes.
he has no other symptoms. Clear?
Yeah. Yes.
What else? Mass in the esophagus, I mean the food pipe, it will not cause um, heart racing or change in voice. Unlikely. Okay?
Yes.
It will
Yes.
not cause loose bowel motion. So the problem is thyroid, very clear. If the patient has only change in voice and throat pain, and for example, few days, it will be, what is the diagnosis?
Laryngitis.
Laryngitis, yes. So inflammation and infection in the larynx, in the voice box. Okay, so you can tell him, according to your data, it could be lump in the front of your neck in the thyroid gland. I'm sorry to say that. That's why you have blah, 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 blah. Mention the symptoms, clear?
Yes.
That's why you have throat pain, change in voice, loss bowel motion, loss of weight, also sometimes heart racing, like that. Okay. So the management plan, you can say, I will keep you in observation room to complete physical examination from head to toe. I will do examination for your neck. So you should start by the neck. Easy? Okay.
Yes.
I will examine the front of your neck for the thyroid gland and examine your heart. So when you talk about neck, don't forget the heart. Easy?
Yes.
Then what you will do, investigation, as you said. So inflammatory markers, infection screen, thyroid hormones, and what else you will do?
Ultrasound.
Ultrasound for the neck. Okay, well
I,
done.
I forget this
And
one.
and
Yes.
heart tracing. And heart.
Yes.
So any thyroid, don't forget the heart.
Okay.
Atrial fibrillation. Easy?
Yes. Yes.
Okay, most likely atrial fibrillation. Or any arrhythmia, but the most common is atrial fibrillation. Okay. Then the decision to discharge and to admit. You did not give me clear decision. Okay. So you can give the possibilities. You can say, start by any possibility, no problem. For
Mm.
me, because the patient has symptoms, clear. So I will start
Yes.
by the likely problem. It means admission. Okay. So you can say like
Yes.
that. I will see your blood results, your heart tracing. If I find any problem in the blood results or the examination or the heart tracing, for this reason, you need admission under medical team. But if I find your vital signs normal, examination normal, heart tracing normal, then I can discharge you to JB, discharge letter, printed leaflet. You can follow up the thyroid hormone functions with your GP. Easy?
Yes.
This is how to make the decisions clear. Okay, Omar?
Yes. Yes. Yes.
Well done. So you should optimize the management plan, optimize the decisions, optimize the blood test, optimize the workup. So
Okay.
don't forget heart tracing, don't forget the ultrasound scan for the neck, and so on. Okay?
Yeah.
Well done. I
Okay.
will give you 9 out of 10. Well done. Thank you.
Thank you.
So I think uh, okay. So here after uh, your feedback, accuracy, I think 95%. Skillfulness, you are very fluent, 100%. Efficiency structure, 100%. Very organized. Supportiveness, you are doing very well, 100%. Safety, 95%. Clear?
Okay.
Well done. Next one, Nagla.
Assalamualaikum.
Alaikum assalam. So, part one, then Socrates, then review of systems, then part two, then the diagnosis and the management plan. Okay. Nagla, you have 30 seconds, then 6 minutes. Headache, what is the most relevant system?
CNS and musculoskeletal.
Of course, after Socrates, okay?
Yes.
So you will start part one, then Socrates, then review of system, then part two, then diagnosis management plan.
Okay. Okay, can I start?
Mhm.
Okay, hello, my name is Dr. Najla. I'm an emergency registrar. Can I confirm your name and age, please?
I'm Fadi. I'm 31.
Nice to meet you, Fadi. How can I help you today?
I have headache, doctor.
Sorry to hear that. Are you in pain now?
It's okay, the nurse gave me painkiller.
Okay. Whenever you feel that you are in pain, just you will inform me. I need to collect some data from you. Is it okay with you?
Yeah.
Okay. Can you tell me more about the headache, please?
Yeah, the problem started since 10 years, and every month I have the same headache in the right side. And if I have this headache, I want to hit my head on the wall.
Sorry to hear that. So you told me that the problem started 10 years ago and it comes every month. And when you feel that there is a pain, you think that you need to hit your head in the wall, and it's mainly on the right side. Am I right?
Yes, yes.
Okay. Does the headache radiate anywhere in your body, like your eyes,
Yes, the
your
right eye. Right
the
eye.
right eye? Okay. And can you describe the pain? Is it sharp? Is it
Sharp,
tearing?
sharp.
Sharp pain. From 0 to 1, 0 to 1 and 0 to 10, sorry, and 10 is the maximum. Can you describe the intensity of the pain?
9.
9, huh? So sorry about that. Okay. Uh, for the pain, what do you think will decrease the pain if
No-
the headache if it's come?
Nothing.
Mm. And what will aggravate it? Do you know?
I don't know.
Okay. Okay. Um, okay. For the pain, you told me that it affects your eye. Do you notice that any change in your vision or
No change in vision,
redness?
but I feel discharge and redness in the right eye.
Discharge and redness in the right eye?
Yeah.
Do you notice that you have any visual disturbance with it?
No, no,
Any loss of consciousness?
no,
Do you notice that you have any numbness,
no, no,
weakness
no,
in your body? Okay. Do you have any chest pain?
no,
Any heart racing?
no, no,
Any dizziness?
no,
Mm. Do you have any shortness of breathing?
no,
No cough?
no,
Any bowel disturbance in your bowel?
no, no,
Change in your urine?
no,
Mhm. Do you have any trauma?
no,
Any fever?
no,
Do you notice that there is a sweating?
no,
Loss of weight?
no,
Loss of appetite?
no,
Any lumps and bumps in your body?
no,
Okay. Do you have any past medical history except this 10 years of the headache?
no, no,
No previous surgery?
no,
Do you have any allergies?
no,
Any disease run in your family?
no.
Okay, I'm asking this question for all my patients. It's a little bit personal. Where do you live and with whom?
My family downtown.
What do you do for a living?
I'm receptionist.
Okay. Do you smoke?
No,
Do you drink alcohol?
no,
Okay, sorry about this question. Are you taking any illicit drugs?
no, no,
Okay. Do you want to add anything?
no,
Okay. Do you have any concern except this headache that's affecting your life for these 10 years?
Actually, I'm worried every time they are giving me treatment, but the problem recurring, you know.
Mm-hmm. I appreciate your concern and worries, Mr. Fadi. Don't worry, because till now the diagnosis is going to a benign headache because there is no loss of consciousness or weakness or numbness in your body. So most probably it's a benign headache that we call in the medical term like a cluster headache. Did you hear about it on this 10 years or someone did inform you about it? Hello?
If the actor is silent, we can proceed.
Okay, okay. So the most probable likely diagnosis is in the medical term called the cluster headache. It's a benign headache. But for that, I will keep you in the observation room because it's a recurrent headache monthly. And I will do for you full examination, mainly your nervous system and the back of your eyes. And I will take all the vital signs, including your blood pressure and the pulse and all necessary vital signs that needed. And I will keep you in high flow oxygen just to decrease the headache a
Thank
little
you.
bit.
Thank you. Your time done.
Okay.
Okay, I will give you 30 seconds. You can continue.
And I will give you a medication called cimetretan. It's in your skin to decrease the pain a little bit. And I will give you a referral to your GP and your neurology. It's a nervous system doctor, so he will follow up with you.
Okay, thank you.
You understand my plan? Okay, thank you.
What do you think, Nagla?
No, I'm not sure.
Okay.
It's the first time I'm practicing, so I really want someone to optimize my.
Okay, you are doing very well. So this patient has a headache in the right side and referred to the right eye. If the patient has headache, recurrent headache in the right eye, it's most likely benign. If the headache since 10 years, of course benign. Do you think he
Yeah,
has a stroke? Of course not. Do you think
yeah,
he has tumor? Of course not. For 10 years, no. Okay.
yeah.
So the patient has recurrent headache the same time, whatever, every month, every 2 months, every 1 week, like that. So this is recurrent headache, which is called in medical term cluster headache. So you should say recurrent and
Okay.
then episodic,
Class.
then cluster headache. Anyway,
Oh,
so once he say, I have been referred to the right eye, then you should ask any redness, any discharge from the right eye, any discharge from the right nostril. Clear?
okay. I missed the
So
nostril. Okay.
directly, once he say referred to the right eye, don't forget. Ask immediately. Okay. Um, You did well. So you ask the first open question, then the second open question, and you repeated the answer of second open question. And Socrates, you ask about the site, but you did not ask when the pain start, sudden or gradual. You did not ask about this one. Clear?
Okay.
You ask about the description, you ask about the spread. Also, this one, of course, continuous or on and off. No need to ask this one. You can say, so the pain is on and off. You can just emphasize on that. Show the
Okay.
examiner that you are aware about this point. Clear?
Okay.
So you can tell him you said the pain recurring every month. It means on and off, right? He will say yes. Clear?
Yes.
Then ask him, is the pain um, return worsening or same or improving? Clear? This is important also. Okay.
Mm-hmm.
Maybe he will
Mm-hmm.
say every time the same. Okay.
Okay.
Well done. So you ask everything except the onset and the
Yeah.
time. Okay. Uh,
Yeah.
the systems you started by CNS. You did well. Did you ask about jerky movements?
No.
No.
Sorry. I didn't miss it.
Important.
Yeah.
Important.
Yeah.
Okay.
Yeah.
Because you said benign. Okay, benign according to what? So if the
Loss
patient has
loss
no
of.
jerky movements, no
Mm-hmm.
vision problem, no loss of consciousness, no numbness, no weakness, and no trauma, so it's benign until proven otherwise.
Mm-hmm.
Excellent.
I
Okay.
missed jerky. Yeah.
Yes. So here I think you are doing very well. The second part you finished also. The diagnosis you finished and the management plan. Excellent. Then the feedback, so accuracy 95%, skillfulness 100%, efficiency structure you are organized 100%, supportiveness 100%, safety so 100% also. Well done. So what you will do with this one, with neurology or GB? GB. Okay.
GP.
You said
Okay.
benign. Okay. So you can say according to your data you have recurrent headache every month and the first episode 10 years ago. So this is episodic headache. Since you don't have any worrying symptoms, so it could be benign, which is called in medical term cluster headache. For this reason, we will keep you in observation room, do complete physical examination, examine your brain, nerves, and the back of your eyes to be sure you don't have any worrying signs. So we said no worrying symptoms from the data. We want to be sure no worrying signs from the examination, right?
Yeah.
Okay. Then we will do some blood tests, including inflammatory markers, infection screen, and what
blood.
else? You will
Full
give
blood.
the patient high flow oxygen
Yeah.
and sumatriptan medication below your skin or under your
Skin.
skin. Okay.
Yeah.
Well done. I think you mentioned everything. So I will give you 9 out of 10. Well done. Thank you.
Thank you very much.
Well done. Next one, Giovanna.
Yes, sir.
Chest pain. So what is the most relevant system?
CVS and respiratory.
Your voice is far.
CVS and respiratory.
Cardiovascular and respiratory. Okay.
Yes.
So if the patient has chest pain, most likely heart attack if the patient said the pain in the center and on and off and sudden. So it's a heart attack under provenance. If he said the pain in the right upper part or left upper part or the right side or the left side, so it could be pulmonary embolism until proven otherwise. Clear?
Okay.
Okay, so you have 30 seconds and 6 minutes.
Shall I start, sir?
And this patient, you should move to resus room in the beginning, connected to heart monitor, and blah, blah, blah. Okay, if you want to start, you can start.
Good morning. I'm Dr. Gina, ED Registrar. May I know your name and age, please?
I'm Fadi, I'm Serton.
Hello, Mr. Fadi. Nice to meet you. How can I help you today?
I have chest pain, doctor.
Oh, I'm so sorry to hear about that. I need to move you to the resuscitation room and hook to the monitor to check your vital signs. Make sure that you are okay. Is that okay?
Yes.
Are you comfortable? Do you have any pain now?
The nurse gave me morphine.
Okay. I need to take some data regarding your chest pain. Is that okay for you?
Yes.
Can you tell me more about your chest pain?
The pain started 1 hour ago, on and off. I think it's worsening, and this is the worst pain I got in my life.
So you said that your pain started 1 hour ago. It's on and off and it's worsening. And this is the worst pain that you have experienced. Is that right?
Yes.
Where did the pain start exactly?
I told you.
Is it center?
You mean the site?
Yes, yes.
Okay, the site in the center, yes.
Okay. Is it radiating anywhere?
Yes, to the shoulder.
Okay. Uh, how can you describe the pain?
Sharp.
Is it okay? And is it continuous
No, on and off.
or on and off? Okay. Anything that makes worse?
No,
Anything that makes better?
no.
On a scale of 1 to 10, can you score your pain?
9,
10 being the worst.
9.
Oh, I'm so sorry to hear about that. Do you have any shortness of breath?
No, no,
Any cough?
no,
Any um, heart racing?
no, no,
Any dizziness?
no,
Uh, do you feel sick?
no,
Do you throw up?
no,
Any change in your bowel?
no,
Any change in your urine?
no,
Any skin rashes?
no,
Any headache?
no,
Any jerky moments?
no,
Any loss of consciousness?
no, no,
Any numbness?
No.
Any recent trauma?
No.
Do you have any night sweats
No.
or any high temperatures?
No.
Any change in your appetite?
No.
Did you lose weight?
No.
Any lumps in your body?
No.
Any previous medical diseases?
No.
Any previous surgeries?
No.
Any allergies?
No.
Any diseases running in your family?
No.
I need to take some personal questions, and these are questions that we ask for everyone. Whom do you live and where do you live?
With my family downtown.
What do you do for a living?
Carpenter.
Okay. Do you smoke?
No.
Do you drink alcohol?
No.
By any chance, do you take any illicit drugs?
No.
Would you like to add anything?
No.
Okay. What's your concern, Mr. Fadi?
Is it heart attack, doctor?
I appreciate your concern, Mr. Fadi. According to the data I've collected from you, I need to take heart tracing and I need to take complete examination that includes
Is it
your
heart attack, doctor?
yeah, I need to take heart tracing. I need to check your heart
Is it heart
rhythm.
attack, doctor?
It could be. So for that, I need to keep you in this room and I need to examine you and take EKG, heart rhythm. Okay. I can see that there are some changes in your heart rhythm. I'm so sorry to say that. The problems in your there may be a clot in the blood vessel that's supplying the heart. Do you understand, Mr. Fadi? Okay, and I need to take some blood tests that involve cardiac markers and CVC panel, and mm, there are some ST elevations, and that I will be doing the heart score. And as per the heart score, I think I need to keep you in the admission and refer to the cardiologist for the management. Do you understand, Mr. Fadi? Hello? There is ST elevation in the area.
So what you will do with me, doctor? I will go home or what? What can I
No,
do?
no, no. I need to keep you in the resuscitation room, and because there is a clot in your blood vessel, I will be giving some drugs that dissolve the
Thank you.
blood.
Thank you.
Yeah. Okay.
Okay. What is the diagnosis, doctor?
There is the inferior wall ST depression
I
and
don't care
severe
about the
invasion.
ECG. What is the diagnosis?
It's a heart attack.
Yes, what does it mean, heart attack?
It's a serious condition.
Acute coronary syndrome. Acute
Yes,
coronary syndrome. You have three differential diagnoses. It could be STEMI, it could be non-STEMI, it could be unstable angina, right?
yes, yes,
How to know acute coronary syndrome? Chest pain started sudden and severe where in the center of the chest. On and off, referred, associated with any symptom. Easy?
yes,
So this patient has typical chest pain? Yes, because the pain in the center, on and off, sudden, severe. Clear?
yes,
So he asked, is it heart attack? I'm sorry, try to show empathy, sympathy. Don't say yes. You can say, I'm sorry, it could be heart attack. Easy?
okay,
So when you answer him, try to show sadness. Your voice should be low, but should be audible and slow. Easy?
okay,
I'm sorry. it could be heart attack. For this reason, I will keep you connected in the resuscitation room, connected to heart monitor, and examine you, your chest, heart, and lungs. Do complete blood test, including what? Heart
Cardiac
functions. Heart functions.
Yeah.
The patient doesn't know cardiac exam. You can say heart functions, okay? And do
Okay.
heart tracing. Once they show you the heart tracing, so here you can follow heart score even without mentioning the term heart score because the patient doesn't know heart score, okay? So heart score, it means H-E-A-R-T. H-E-A-R-T. H history. The history here, typical or not typical?
Typical.
How many points?
So
How many points,
2
guys?
points.
2 points. And then ECG, significant ST depression. Okay? So significant ST depression, how many points?
1 point.
2 points. 2 points. Significant. Significant means maximum. It means 2 points. Clear? So total now 4. Then age. How old is the patient?
28.
How old is the patient?
It's 28 now.
I cannot hear you, doctor. Your voice should be
31.
clear. You can consider yourself in the exam now. You have camera in the room and this camera with mic. So the mic, your voice should be audible, should be clear. Try to make your voice clear, your accent clear. Your voice should be audible. So the age, how old is the patient?
31.
68.
I cannot hear you, doctor.
Sir, I think it's 68.
30 plus, okay. So I don't care about 30 or 30 plus. I care about this
So
is
that's it.
more than 65 or less than 65 or less than 45. Easy.
Okay.
So if more than 65, 2 points. If more than 45, 1 point. If less than 45, 0 point. Easy.
Yes, sir.
So this one, how many points for the age?
Ze-
0.
0.
Okay. So the history, the patient has chest pain in the center, 2 points. The ECG, 2 points. And the age, 0 point. Then are risk factors. The patient has any risk factors?
No.
No, no
No,
past
sir.
medical disease and no smoking, no alcohol, nothing. Okay. So the patient has no risk factor. So 0. So T, troponin. Do we have idea about troponin? No. So the total score 4. If the score is less than 7, it means this patient, what you will do with him?
We'll keep in observation and repeat. We'll keep in
You will
observation and
wait,
do
you will wait
gentle.
for troponin, right?
Yes, sir.
You cannot discharge and you cannot admit now. Okay. So the patient, if the troponin, give 2 possibilities. You can tell him, according to your data, I'm sorry, it could be heart attack. According to your heart tracing, it's supporting the problem. But the good news, your age is less than
65.
45.
Okay.
The age is the good news, the age is 45. Okay. If less than 65, it means you're not good. Okay. Maybe 50, maybe 60, not good. So you can say the good news, your age is less than 45, and you don't have any risk factors. You don't have any past medical disease. You don't have any risk factors, is better. Okay. So we should wait for the heart function. Then give him 2 possibilities. If the heart functions abnormal, what you will do?
If heart function is abnormal, then we need to refer to a cardiologist.
Activate cath lab. If the heart functions
Yes.
are abnormal, you will activate cath lab. Okay, so invasive strategy. Okay, so he went to activate cath lab. If the ECG is showing ST elevation, ST elevation in one lead not important. Okay, so you can say if in general, guys, in real practice, if you find the ST elevation in more than one lead in consecutive leads, so it will be STEMI. STEMI, no need to wait for troponin. You can send it to cath lab. Okay. If the ECG is not showing STEMI, here you can use heart score. So don't use heart score in STEMI. I want to use heart score if the patient ECG normal or ST depression. Easy, doctor?
Yes.
So he want to use
Yes, sir.
heart score if the ECG is not showing STEMI, not showing ST elevation. ST elevation in AVR only, not significant. Okay. But if you find in consecutive leads, for example, inferior leads and chest leads like that, or lateral leads, you can refer to cath lab. Anyway, so you can give him two possible. You can tell him if the heart functions are abnormal, I will move you now to cath lab. This is invasive procedure to check the heart arteries and remove the blood clot, and they can put a stent to protect the heart arteries. Then give him the other possibility. If we find the heart functions normal, what you will do?
Follow.
Huh?
Advice follow with the cardiology.
Okay, so you will admit under the heart doctor. Can you discharge this patient? Be active, guys. Can you discharge this
No,
patient?
no,
Okay. Oh,
no, sir.
So you cannot
No,
discharge
need admission.
any patient.
Repeat after 3 hours.
Any patient with typical chest pain, especially with this ECG, you cannot discharge. Any chest pain, not for discharge. Okay?
Hmm.
So you can admit under heart doctor, and you will repeat the heart functions after
3 hours.
3 hours. Easy?
Yes.
Okay. So in the exam, if you find the history typical, and the ECG significant, and the risk factors, and the age is more than 65, this patient cath lab. Easy?
Yes,
Yes.
yes.
If the chest pain
yes,
is
sir.
typical, the patient has risk factors 3, the patient has significant ST depression, the age is more than 65, this patient cath lab. So you can say, according to your data, I'm sorry, you have typical chest pain, and your heart rate racing is supporting the problem, significant changes, and your age, I'm sorry to say that, is more than 65, and this is not good for this problem. What else? You have risk factors, and you can mention them, no problem. You can say, for example, you have high blood pressure, high blah, 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 blah. Okay. For this reason, I will move you now to cath lab. I will call the heart doctor. They will prepare for cath lab. It's a blah, 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 blah. Easy, guys, now how to take decision in such a case, whatever in real practice or in the exam?
Yes, doctor.
Yes.
Okay.
Doctor, I have one concern, doctor. This ECG is not posterior STEMI?
No, not posterior, because posterior you will find ST horizontal. This one not horizontal. You will find the horizontal ST depression in V2, V3. Clear? But not in all leads like that. Clear?
Okay.
This one you can say STEMI equivalent. STEMI
For
equivalent.
B1 also there is some elevation. That's why
In AVR not enough to say STEMI. You can say
no,
STEMI
AVR
equivalent.
and B1.
In horizontal, for posterior MI, you will find horizontal ST depression, okay, in V2, V3, and the R wave will be high in V2, V3, okay?
Okay.
it will be in V2, V3 only. Okay. So I will give you 8 out of 10, Giovanna, okay?
Okay.
Emmanuel?
Yes, sir.
Okay. In flank pain, Emmanuel, the patient,
Yes, sir.
you should understand where is the pain. In the scenario, if they mention flank pain, you can use the term flank. Okay. So if you ask him, how can I help you? If he said, I have pain, you can ask, where is the pain? You can confirm. Okay. Why? Because you will give painkiller 3 times in the exam or maybe 4 times. Easy?
Yes.
So if the pain in the flank, you can give, what is the first line? Please, guys, be
Paracetamol.
active. We are wasting the time like that. What is the first line?
Diclofenac.
Diclofenac sodium.
Diclofenac. Okay. You should listen to previous recordings, prepare before the session, and be active to save time. Otherwise, the session will be 4 hours or 5 hours. Okay. So what is the first line?
Diclofenac
Diclofenac.
sodium.
Diclofenac sodium. IM 75 milligram. What is the second line?
Paracetamol.
Paracetamol.
Paracetamol
1 gram.
IV 1 gram. What is the third line?
Morphine
Morphine.
IV 5 milligram
5
IV.
Okay.
Morphine. You can give first 5 milligram IV, second morphine 5 milligram, third morphine 5 milligram, next 5 milligram. So you can titrate up to 20 milligram morphine. Clear, Dr. Emmanuel?
Yes, sir.
Okay. So how you know the patient has pain? He's showing discomfort in his eyes. He's closing his eyes. He's twisting. For example, like that. Clear?
Yes, sir.
So this patient in pain. After maybe 5 minutes, maybe he has pain again. Okay. You can confirm if he has pain and offer the second line. Then you can give if he has pain, third line. Clear, doctor?
Yes, sir.
And so on. Okay. So
Sure.
I will show you pain, discomfort, tenderness, and what you will do, ask him where is the pain, and then any allergy. Then in the exam, you don't have nurse. In the room, you are sitting with the actor, whatever he is in the seat or in lying in the bed. Then you can just turn your head, please nurse, give the patient diclofenac sodium, blah, 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 blah. You don't have nurse, but you are pretending. This exam is acting. Clear?
Yes, sir.
After give him the painkiller, ask him, after the painkiller, are you okay? He will say yes. Easy?
Yes, sir.
Okay. Your voice is far. I don't know why your voice is far, you guys.
Yes, sir. Now it is audible, sir.
Audible but far. Anyway, not for me, for other guys. For me, I can.
Yes, sir.
Anyway, so you have 30 seconds and 6 minutes. You can start.
Hi, I'm Dr. Emmanuel. I'm one of the ED registrars. May I know your name and age, please?
I'm Fadi. I'm 31.
Oh, nice to meet you, Mr. Fadi. May I know what happened to you? Why you came to hospital?
I have tummy pain, doctor.
Oh, I'm so sorry to hear that. Are you feeling comfortable or do you have pain right now?
I have pain.
Okay. Mr. Fadi, like from 1 to 10 score, how much do you rate your pain score?
I have pain, doctor.
Okay, Mr. Fadi, I will take you to observation room and I will give you a pain management. Nurse, can you please provide Mr. Fadi one IV IM diclofenac sodium, 75 mg stat. Are you comfortable, Mr. Paddy?
It's okay, yes.
Yeah. Okay. Mr. Paddy, I would like to know more information regarding your problem. Can we please discuss? Mr. Paddy, I would like to know more information regarding your problem.
If the actor is silent, proceed, doctor. No need to repeat many times.
Yes. Okay. Mr. Paddy, like since when you are having this pain?
1 hour ago.
1 hour ago. Okay. Is it like a tummy pain or like a flank pain?
Flank pain, doctor.
Okay. It is in the left side or the right side?
Right side.
Okay. 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 Since 1 hour you are having this pain, is this pain? What is the character? What is the? How do you feel this pain like? Does this pain spread anywhere else in the body?
Right groin.
Okay, towards the right groin. Any other complaints you are having other than pain? Oh, I'm sorry. Again, you are having pain, Mr. Paddy? Okay, I will give you a pain management again. Nurse, can you please provide Mr. Paddy 1 gram of IV paracetamol? Are you comfortable, Mr. Paddy?
Yes, yes.
Okay. I would like to ask you a few more questions, Mr. Paddy, regarding your pain. Like any burning, any pain while passing urine you are having?
Yes.
Okay. Any color change in your urine?
Yes.
Okay. Any like giddiness or vomitings? Any fainting?
What do you mean by fainting?
Like giddiness?
What does it mean, giddiness?
Like any feeling of loss of consciousness like that?
No.
Okay. Any chest pain?
No.
Okay. Any heart racing?
No.
Okay. Any swelling in your body?
No.
Okay. Is this pain the same by the time since 1 hour? It is like suddenly you got, right? It is a worsening or like it is progressively slowing down your pain? Oh, I'm so sorry to hear. I'll provide you the third dose of pharmacological management. Nurse, can you please provide Mr. Paddy 5 milligrams of morphine IV? Are you comfortable, Mr. Paddy?
Yes, yes.
Okay. Anything that cause improving or worsening your pain, Mr. Paddy?
No.
Okay. Yeah. From 1 to 10 score, how would you rate your pain score, Mr. Paddy?
Like 9.
Okay. Initially, it was right now?
Yeah, I am okay now.
Yeah, okay. I would like to ask a few more questions regarding your personal data. Do you have any medical history in your family? Any disease? Do you have any past medical history, Mr. Paddy?
No.
Any previous surgeries?
No.
Okay. Any allergies?
No.
Any diseases running in your family?
No.
Okay. Where do you live and where do you stay, Mr. Paddy?
With my family downtown.
By any chance, do you smoke or drink alcohol?
No.
Any chance you take any illicit drugs? Oh, I'm so sorry. Yeah. I'll give you, provide you another medication. Nurse, can you please provide Mr. Paddy another 5 mg of IV morphine?
Thank you. Your time done. Okay, I will give you 30 seconds.
Are you comfortable, Paddy?
Yes, yes.
Okay. Okay. What are your, do you have any questions, Mr. Paddy?
No.
Okay. What do you think about any idea of why this pain came? Do you have any idea or any concerns?
What is the problem, doctor? Is it serious? Do I need any imaging, any admission, any surgery?
Yeah, yeah, I appreciate your concern,
Thank
Mr.
you. Your
Paddy.
time done. Okay, thank you. Okay. What do you think, Emmanuel?
Sir, I am a little bit tense and I forgot about a few things.
Okay.
And
You are doing very well. I want you to focus on the most important points. Clear?
yes, yes,
This patient has flank pain. Okay.
yes,
So before giving the painkiller, diclofenac, you should ask about the site only. No need to ask about Socrates to give him pain. Clear?
I didn't get it, sir.
Before giving the painkiller, ask about the site only. No need to ask for all Socrates to give painkiller.
Yeah, got it, sir. Understood.
Okay, so you
Yeah,
give him the painkiller without asking the site. So more than enough
yes,
to ask about the site and the allergies. Easy.
yes, sir.
The site to confirm it's not MI. So if he says
Yeah,
the pain in the epigastrium, don't give diclofenac. Easy.
yes, yes, sir.
Any patient has pain in the chest or in the epigastrium, don't give diclofenac.
I got it, sir.
Serious. It's dangerous.
Yes,
Okay. But if he said in the flank, and of course maybe mentioned in the scenario, so you can say, how can I help you? You find the patient in discomfort like that, then
yes, sir.
even you can, no need to say, how can I help you? You can say, oh, sorry, I can see you are in discomfort. Are you in pain now? If he said yes, ask him, where is the site of the pain? In the right flank.
Yes,
And any allergy? No. Let me give you painkiller now, then take some data from you. Please, nurse, give blah blah blah. Are you comfortable? Yes. Easy? Like that.
yes, sir.
Anyway, you did very well. This patient, no need to ask about ICE. What is your concern? Save time. Okay?
Yes, sir.
No need to ask about his idea, no need to ask about expectation, no need to waste the time. So what is your concern? Okay, I appreciate your concern. According to your data, the most likely problem, it could be stone where kidney, ureter, bladder system. Clear, doctor?
Yes, sir.
Stone in the kidney, ureter, bladder system. Okay. So what is the most relevant here? Flank pain,
Flank pain,
urogenital,
urogenital
and the
and GI.
GI. So urogenital, you will ask him, do you have any change in your urine? More than enough. You want to
Yes,
give him examples? Give him examples. Any change in your urine? Any burning micturition? Clear? Any
yes, sir.
change in the color? More than enough. Then GIT. GIT, you can ask any yellow discoloration of your eyes or your skin. Any change in bowel habit? More than enough. We finished urogenital and the GIT. Then other systems. Very concise. Okay?
Yes, sir.
So the patient in the end, according to your data, it could be a stone in the kidney, ureter, bladder system, or you can say kidney, ureter, or bladder system, which is called in medical term renal colic. Easy?
Yes, sir.
More than enough. What you will do for him? I will keep you in observation room to complete physical examination, examine your
Tummy and urogenital.
tummy.
Yes, sir.
Then kidney, ureter, bladder, system. More than enough. What else? I will do some blood test, including kidney function test. What else? Urine test. What else? Ultrasound scan, or you will do CT scan. What do you think?
CTKUB, sir. Ultrasound and
Yes,
CTK.
without contrast. So you will do imaging for your kidney, ureter, bladder system, which is called CT scan, but
Yes, sir.
without contrast. Clear?
Yes, yes, sir. Clear,
Okay.
sir.
Then give him the indications for admission. You can say to decide to admit you or discharge, it depends on some indications. So if the pain is not improving, or if the kidney function is impaired, or severe infection in the urine test, or what else? If the size of the kidney stone or the size of the stone is more than 5 mm. Easy?
Yes, sir.
More than enough. You did not mention the management plan. I will deduct 2 marks. Okay.
Yeah.
So try to be very concise and work on the non-medical terms, please. Okay.
Yeah,
So
should, sir.
what to do for yourself in any history? Work on the general approach. So memorize. So you can say, I need to take some data. This is how to take consent.
Yes,
More than enough. I need to take some data from you. More than enough. Okay. Regarding the questions, try to work on the wording, the review of systems. So try to work on the wording, memorize the general approaches. Okay.
yes, sir.
This will save your time. Okay.
Should, sir. Yes,
So
sir.
8 minutes or even 6 minutes or even 4 minutes, more than enough to finish the station. How to finish the station? Very quickly, memorizing the general approach. Part 1, then Socrates, then review of system, started by the most relevant, okay? Then part 2, then diagnosis and the management plan. It depends on the company. So I will give you 8 out of 10. Thank you.
Thanks.
Next one, Ahmed.
Yes,
Ahmed?
Dr. Hani?
Yes, how are you?
Yes. Alhamdulillah, Dr. Hani. How are you?
Hi. Okay. I don't know if you have problem in signal, your voice is distorted.
Now, what is about now?
Okay. Can you hear me clearly, guys?
Yes, Dr. Han.
Okay.
Yes, doctor.
Yes, doctor.
Testicular pain, what is the most relevant system?
Genitourinary?
And
GIT.
yes, okay. So testicular pain, if you find the problem started within hours, so it could be testicular pain, testicular torsion until proven otherwise. If the problem few days, it could be infection or inflammation, epididymitis, for example. If the patient has problem within a few months, it could be malignancy. Clear?
Yes.
Okay, so testicular pain, for example, 1 hour, sudden, he was playing or he was sleeping, so it could be testicular torsion until proven otherwise. What else? The pain is sudden, severe, so this is typical for torsion. Sudden, severe, typical. Okay. What else? Redness, swelling. Okay. So any lump in your body, maybe he will say, yes, I have lump in my testicle. Okay. What else? So if you find these symptoms, so for sure it could be testicular torsion, but you need to confirm that by examination. If confirmed by examination, move now to urologist. No need for ultrasound, Doppler ultrasound. But if he said, for example, the pain 1 hour, sudden, but no redness, no lump, what you will do? You can say the diagnosis is not um, clear, okay, but it could be twisted also. You have to mention that. You can say you denied any lump, you denied any redness, so we need to confirm that by examination. Then give him two possibilities. You can tell him if the possibility, if the examination is showing blah blah blah, then I will move you to urologist. If the examination is normal, I need to do Doppler ultrasound. Easy, doctor?
Yes, doctor.
Okay. What is the definitive treatment?
Operation.
Yes, surgical exploration.
Fix the testicle.
Surgical exploration. Clear? So the urologist can do surgery to explore and fix the testicle. Okay. Do untwist. So what is the diagnosis? The testicle is twisted and the blood supply is blocked. That's why you have pain. Okay. You have 30 seconds and 60 minutes.
Can start.
You can start.
Good morning. I am Dr. Ahmed, ED Registrar. May I know your name and age, please?
I am Fadi. I'm 31.
Nice to meet you, Mr. Fadi. How can I help you?
I have testicular pain, doctor.
I'm sorry to hear that. Are you in pain now?
It's okay. The nurse gave me painkiller.
Okay, I need to put you in observation room and I will take some data from you. Is it okay for you?
Yes.
Can you tell me more about your testicular pain?
Yes, I was playing football and suddenly, 1 hour ago, suddenly I felt severe and sudden pain in the testicle.
I'm sorry to hear that. You said that you was playing football before 1 hour and suddenly you have this pain, testicular pain. Am I right?
Yes.
Can you tell me where is the exactly pain,
Right
right
side.
or
Right side.
right pain? Okay, and you told me this is a sudden start, this pain. Would you like to describe this pain? It's stabbing, sharp, tearing.
Sharp.
Does the pain spread to anywhere?
No, no.
Is it worsening or improving since 1 hour?
Same.
It is continuous or intermittent?
Continuous.
This pain to first time or it happened for you before?
Last month, I woke up with same pain, but improved without taking anything.
Okay. Anything cause or worse this pain?
No,
Anything improve it?
no.
Can you give a score to this pain from 1 to 10? 10 is the worst.
9.
Okay. Any change in urine?
No, no,
Any urethral discharge?
no,
Any ulcer on or of skin changes?
no, no,
Any change in bowel habit?
no,
Do you feel sick?
no,
Do you throw up?
no.
Any yellow color in skin or eyes?
No, but I have redness in the right testicle.
Okay, I'm sorry to hear that. Any headache?
No,
Any jerky movement?
no,
Any vision problem?
no,
Did you lose consciousness?
no,
Any numbness?
no,
Any weakness?
no,
Any trauma?
no,
Any chest pain?
no,
Any heart racing?
no,
Any dizziness?
no,
Any shortness of breath?
no,
Any cough?
no,
Any noisy breathing?
no.
Any skin changes in all your body and in this area?
I told you, doctor.
Redness?
Yes.
Any high temperature?
No, no,
Do you have any night sweat?
no,
Any change in appetite or weight?
no, no.
Do you feel there is lump in your test or anybody?
No, I feel lump in the right testicle.
Okay. Do you have any past medical disease?
No, no,
Any previous surgery?
no,
Any prescribed medicine?
no, no,
Any allergy?
no,
Any disease run in your family?
no.
I want to ask you some special question. I ask for all patients. Whom do you live and where?
I Live with my family in downtown.
Do you smoke, drink
No,
alcohol, or by any chance, do you use any illicit drugs?
no.
What do you do for a living?
I'm football player, doctor.
Would you like to add anything?
No, no.
What is your concern, mister?
What is the problem, doctor? Do I need any surgery? Is it affecting to get baby?
I appreciate your concern. According to your data, that your pain started suddenly since 1 hour, and there is redness and lumps in the testicle. It could be medical, it could be testicle torsion. It's removed from hair blades, and unfortunately, it need surgery. I need to refer you direct to surgery to do surgery.
You will not
And
examine me, doctor?
I will put you in observation room. I will do full examination and do some special tests and call the surgery for your case. Is it okay for you?
So how to know this problem?
This problem, if there is sudden sudden pain and first time, and if there is lump and redness, it could be torsion,
How to
testicle
know from
torsion.
examination, doctor?
From the examination, I will examine this genital area. If any redness, any tenderness, I will examine you, full examination.
So what is surgery?
Surgery, it will be done by surgeon.
Thank
He
you.
will
Thank you.
okay.
Okay. What do you think, Ahmed?
Yes, last thing I will need to put in observation room, full examination.
Okay. So don't take decision without examination.
Yes.
Clear? So even, for example, the ECG is showing a STEMI, different station. Will you send the patient without examination?
Yes.
No. Any patient you have to examine. Clear? So you can say like that, according to your data, you have redness and lump in the right testicle. The pain started sudden 1 hour ago. It could be
Testicle torsion.
twisting of the testicle, which is called in medical term testicular torsion. Easy?
Yes.
So explain more. You can say the testicle, the right testicle, twisted, rotated. For this reason, no blood supply. The blood supply is blocked. Okay?
Yes.
Even when you are explaining to him, you can move your hand. So use two hands and you can cross the two hands, explain to him. Easy?
Yes.
So you can tell him the right testicle, rotated, twisted, the blood supply is affected, blocked. That's why you have pain, severe pain. The good news, you came within
1 hour.
6 hours.
Since
Yes, he came within 1 hour, but the window 6 hours. Clear?
Mm.
So the good news, you came within 6 hours. Okay, well done. So I need to examine you. If the examination is supporting the problem, if I find the redness, what else? Swelling,
William.
okay, and the tenderness. And I will do some special tests. Even you did not mention the name of the test, okay? Some special test for the testicle with chaperone. Did you mention chaperone?
No.
You should mention chaperone. So I will do some special test to confirm the diagnosis. If the diagnosis confirm, what you will do, refer to urologist. If I find the diagnosis is not confirmed by examination, so in such case, I will do Doppler ultrasound scan for both testicles. Easy?
Yes.
And accordingly, I will take decision. Okay. So what if he said, will this affect getting baby? What will you say?
No, you have two testicle or like this.
So you can say, I appreciate your concern. We will see the urologist can do a surgical exploration and see if the testicle is viable. So you still can get baby. So he can fix it. So the problem will not return. And if unfortunately, or you can say if voidable, uh, do resection if the testicle is not viable, so you can still get baby because you have another testicle. Easy?
Yes.
Yes. Okay. So I will give you 8 out of 10. You should optimize the decision and management plan. Clear?
Thank you.
Well done. Next one, Basamat?
Yes, doctor.
Yes. So the next station, back pain. So back pain, what is the most relevant system?
Musculoskeletal and CNS.
Yes. If back, remember front. I mean, so any back problem, you will ask about the relevant system. It means musculoskeletal CNS. Then front. What does it mean front? Tummy, abdomen. It means urogenital and GIT. Easy?
Okay.
So any back pain, you will ask about 4 systems. Musculoskeletal CNS, and then,
Urogenital and GIT.
yes, why? Because maybe coda equina. Easy?
Yes, yes.
So back and the front. What if the patient has front problem? I mean tummy problem. Ask about tummy and then back. Easy?
Okay.
Because also maybe the patient, for example, has coda equina if he has any change in bowel or any change in urine. Okay. You have 30 seconds and 6 minutes. So if the patient has back pain, what are the causes? If he mentioned trauma, do you have any trauma? He said yes. What is the diagnosis?
Trauma.
The diagnosis
Maybe
trauma or fracture?
fracture.
Fracture. Okay. So if he said the pain start at rest and improve with exercise, what is the diagnosis? What is the diagnosis, guys?
Inflammatory?
Inflammation. Any patient, I have, for example, pain in the limb. He said the pain start at rest and improve with exercise. So inflammation. I have knee pain. Start at rest, improve with exercise. Inflammation. I have back pain. Start at rest, improve with exercise. What is the diagnosis?
Inflammation.
Inflammation. Okay. The pain start at morning. When I woke up, I have this pain. After few hours, no more pain. So inflammation. Easy? Okay. The
Yes.
patient has, he said, using illicit drugs. What is the diagnosis?
Abscess. Maybe
Why
abscess.
abscess? Why abscess?
Infection.
Why you think about
Infection.
specific things? Infection. Clear, doctor?
Yes.
No need to say, uh, no need to say arthritis. Why I will say arthritis? You can say inflammation. Why I will think about specific thing? Don't ask specific questions and no need to think about specific diagnosis. Easy?
Yes.
Try to make everything easy, simple. Okay? So the patient has loss of weight and lump in his back.
Malignancy.
Malignancy. The patient has loss of weight and lump in his back and he has lung cancer.
Metastasis.
Secondary.
Metastasis.
Metastasis.
Metastasis. So secondary malignancy. Okay. So you have diagnosis primary or secondary malignancy. Primary, it means he has symptoms of malignancy but he has no previous malignancy. Easy. Secondary, he has symptoms of malignancy, but he has history of malignancy. Easy.
Yes.
Yes.
Okay. So the patient has uh, no trauma, no symptoms of inflammation, no illicit drugs, and no loss of weight. But the patient was lifting heavy objects and he has back pain. What is the diagnosis?
Could be, it could be sciatica.
This prolapse.
Disc related.
Disc prolapse. Disc prolapse. Is it fracture?
No.
No. Did I mention trauma? No. Did I mention the pain start at rest and improve with exercise? No. Did I mention illicit drugs? No. Did I mention constitutional symptoms? No. So the patient has pain after lifting heavy objects. So disc prolapse. Easy.
Yes.
This how to catch the diagnosis, guys. Okay. You have
Okay.
you have 30 seconds and 6 minutes. Okay.
Good morning. I'm Dr. Basamat. I'm ED registrar. May I know your name and age, please?
I am Fadi Sertuan.
Nice to meet you, Mr. Fadi. How can I help you?
I have back pain, doctor.
Sorry to hear about that. Do you need a painkiller?
The nurse gave me painkiller.
Are you comfortable?
It's okay. It's okay.
Okay. Can you tell me, I need to take some data from you. Anything you will say to me, it will be private, and the nurse will be with us. Can you tell me more about the back pain?
Yes, the problem started 3 days ago. Started sudden and increasing, worsening, and continuous.
So you said the pain started 3 days ago and started sudden, worsening, and continuous. Where is the back pain exactly?
In the
In the
center,
upper back.
in the lower back.
Okay. Then can you describe it? Is it like pressure, stabbing pain, or sharp pain?
Sharp
Is it radiating to anywhere?
to the lower limbs,
One limb or both limbs?
both lower limbs.
Is it improving or worsening? You said for me it's worsening.
Yes,
Is it on and off or continuous?
continuous, I told you.
There is anything make it better?
No.
Anything make it worse?
I think this happened after I lift heavy objects. I'm carpenter and I was lifting a box and suddenly I felt severe pain in the lower back.
Sorry to hear about that. So from 1 to 10, the 10 is the most severe pain. Can you score your pain? How much can you score your pain?
Like 7.
Okay. There was any weakness or numbness with the pain?
No, no,
Any swelling or hotness or coldness in the limbs?
no,
Any trauma?
no trauma.
Any headache?
No,
Any loss of consciousness?
no, no,
Any jerky movement?
no,
Any visual disturbances?
no,
Did you feel sick?
no,
Did you throw up?
no,
Any bowel changes?
no, no,
Any tummy pain?
no,
Any change in your skin or eyes?
no.
Any change in the urine?
I have no change in the urine, but today I couldn't pass urine.
Okay, sorry to hear about that. Any flank pain?
No, no,
Any blood in the urine?
no, no,
Any fever?
no,
Any lumps in the body?
no,
Any weight loss or gain?
no,
Any night sweat?
no,
Any chest pain?
no,
Any heart racing?
no,
Any dizziness?
no,
Any breathing difficulty?
no, no,
Any cough?
no,
Any skin rashes or changes?
no,
Any past medical history?
no,
Any past cervical history?
no,
Are you on any prescribed medication?
no,
Do you have any allergies?
no,
Do you have any disease around in your family?
no.
I want to ask some personal questions. I'm asking for all my patients. Where do you live?
In downtown,
With whom?
my family,
What do you do for living?
carpenter,
Um, do you smoke?
no,
Do you drink alcohol?
no, no,
By any chance, do you use any illicit drugs?
no,
Uh, what do you want to add anything?
no, no.
What's your concern?
What is the problem, doctors?
According to your data, the most likely problem with you is back pain due to lifting heavy objects, maybe a disc problem. Um, uh, I'm concerned about a problem called coda equina syndrome, which is like a slip disc causing pressure on your disc. I need to keep you in the observation room, do complete physical examination, and connect you to monitor, check your vital signs, and do some blood tests. And I will order and do examination for your
Thank
nerves,
you.
back.
Thank you. Okay, you can continue 30 seconds.
Okay, I will examine your back, your nerves, and back of your eyes. And according to your examination, maybe I will order MRI for your back and refer you for neurosurgery. Doctor, maybe because of this codequina, you will need some urgent surgery.
Okay,
Do you
thank you.
understand?
Thank you. Thank you, doctor. Okay. Well done, Basamat. Sometimes you are asking the same question. Okay, so try to remember the questions you ask and no need to repeat them. This patient has back pain. What is the diagnosis?
Codequina.
No. What is the diagnosis, guys?
Disc prolapse complicated.
Prolapse or
This
fracture.
disc prolapse. Okay. So coda equina is complication, not diagnosis. Clear?
Okay.
For example, the patient has trauma, and after trauma, he has fracture. After fracture, he has coda equina syndrome. So, what is the diagnosis?
Fracture complicated by
Yes. The patient said the pain, he has lump in the back, and he has constitutional symptoms, and he has also urine retention. What is the diagnosis?
Malignancy complicated by
Yes.
coda.
So the diagnosis then complicated with or without coda equina syndrome. Easy?
Yes.
Okay, so you can say, according to your data, you have sudden back pain in the lower part after lifting heavy objects. It could be disc between two vertebral bodies, prolapse. It means it changed or moved. Easy?
Yes.
Unfortunately, this disc after prolapse make compression, or you can say mid pressure on the spinal cord in the back and make some nerve symptoms. You have pain in the lower limbs, you have problem in urine retention. It could be because of this pressure, which is called in medical term Koda-Equina syndrome. Okay. You will keep the patient in the room in the exam like that, or you will do immobilization? Immobilization.
Should be immobilization.
So what you will say, please, can you lie flat? More than enough. The patient is still sitting. No problem. It's accounted for you. Easy.
Yes.
So you can tell him, please, can you lie flat? Because I have concern regarding your back. Okay, this is better for you. Thank you. And you can continue, even if he's still sitting. We are acting. Okay, so what you will do, you said MRI. Better to say imaging, which is called MRI for your back. So MRI only, not enough. Because MRI for what? MRI for the brain, for the back, for the limbs. Easy?
Okay.
You should be clear. MRI what? MRI imaging for your back. Okay. You should be specific here. Okay. So what you will do, I will refer you now to the, you can say orthopedic or neurosurgeon, so whatever, but focus on one only. Okay. Or you can say for the doctor of the back. Okay. So this patient needs surgery. You can say because this compression on the spinal cord. Okay. Is it sciatica or Koda-Equina syndrome, guys?
No Koda-Equina, there is retention.
Retention. Okay. When to say sciatica? If the patient has no symptoms of Koda-Equina. So you can say no urine retention, no urine incontinence, no bowel retention, I mean constipation, no bowel incontinence, and no sexual dysfunction, no numbness, no weakness, no problem in sensation, no problem in bowel, okay? So no neurological problems, I mean, okay? Also, but not for the purpose of the history, in the examination, we will talk about that. You will do a straight leg test. If the patient has pain when you are raising the leg straight, then it could be sciatica. But again, if the patient has no neurological symptoms. Okay. So I will give you a 9 out of 10, okay? Well done. Okay, next one. Anyone did not practice and is happy to practice? Otherwise, we can go from the start. Omar?
Yes.
Okay. So the next station, knee pain. So same. If the patient has trauma, what is the diagnosis?
Maybe fracture, maybe
Fracture or injury.
or injury. Yes.
You can say knee injury. Why injury? Because injury may be fracture, may be ligament injury. Easy.
Yes.
The previous station back. If the patient has trauma, so you can say it could be injury. Okay, easy.
Yes.
So
Yes.
if the patient has trauma, so it could be knee injury for the bones or knee structures like ligaments,
Okay.
meniscus, like that. Anyway, if the patient has been at rest and improve with exercise,
Inflammation.
inflammation, the patient is using illicit drugs,
Maybe infection.
it could be infection. If the patient has redness, hotness in the knee and the lump in his knee,
Maybe osteoarthritis.
infection,
Knee arthritis. Infection. Yes.
infection. Try to be simple. Try to be
Okay.
simple. It means
Okay.
you have 5 terms. Huh? Injury, infection, inflammation, malignancy,
Inflammation.
metastasis. Easy.
Okay.
Let's choose one of them. I'm trying to make everything clear. I'm trying to make everything simple. So don't make everything complicated. Clear?
Oh, okay.
So if the patient has redness, hotness, lump in his knee, what is the diagnosis?
Infection,
It could be infection. Okay. If the patient has constitutional symptoms,
malignancy or metastasis,
malignancy. The patient has constitutional symptoms and he has past medical disease of lung cancer,
metastasis.
metastasis. Easy?
Yes.
Okay. The general management plan will be same for all. You will do complete physical examination, examining the knee and the other joints. Then you will do some blood tests, including inflammatory markers, infection screen, knee X-ray, ultrasound scan for the knee, and you will do a knee aspiration and the fluid sample to confirm the diagnosis. Done. Fix this management plan for any knee pain or knee swelling. Easy?
Okay.
Okay. You have 30 seconds and 6. What is the most relevant system?
Musculoskeletal CNS.
Okay. You have 30 seconds and 6 minutes. You can start.
Okay, good morning. I am Dr. Omar Idris Sirar. May I know your name and age, please?
I'm Fadi. I'm 31.
Nice to meet you, Mr. Fadi. How can I help you?
I have knee pain, doctor.
Oh, sorry to hear that. Do you still have pain?
The nurse gave me painkiller.
Okay. I need to take some data from you, Mr. Fadi, regarding this knee pain. Is it okay with you?
Yeah.
Okay. Can you tell me more about this pain, Mr. Fadi?
Yes, the problem started 1 week ago, and I found the pain is increasing, worsening, started gradual, and I think the problem is continuous.
Okay. So you told me this knee pain starting 1 week ago, worsening, increasing, gradual, and continuous. Is this right?
Yes,
Can you tell me exactly where is the pain? Which knee?
the right side.
Right. Can you point the pain? It is
I think in the front, sides, and the back also. All the
in
knee.
the front. Okay. Okay. Can you describe the pain, Mr. Fadi?
Pressure.
Is this pain radiating elsewhere?
No.
Did you have this pain before?
No.
Anything improving this pain?
No.
Anything decrease it
No.
or improving it?
No.
Can you score this pain from 1 to 10? 10 is being the worst pain.
It's like 7.
Okay. Do you have any numbness,
No.
weakness,
No.
any trauma,
No.
any vision problem,
No.
any headache,
No.
jerky movement?
No.
Do you lose your conscious?
No.
Okay. Any change in the color,
No.
size of of your limb?
Yeah, I think there is lump in the front of the knee.
Okay. Any change in head distribution in this limb,
No,
in this
no,
side?
no problem in the hair.
Okay. If we compare this knee or this limb with the other side, any change in temperature?
No.
Okay. Uh, do you have any chest pain?
No.
Any shortness of breath?
No.
Any cough or noisy breathing?
No.
Any change in bowel habit?
No.
Any change in urine?
No.
Okay. Do you have any temperature?
No.
Any night sweat?
No.
Any lumps in your body?
I told you I have lump in the front of my knee.
Other than your knee?
No.
Any? Okay. Sorry. Any change in your appetite or in your weight?
No.
Do you have any past medical disease?
Yeah, I think I have blood disease when I was young, something like hemophilia, something like that.
Okay. Any previous surgery?
No, no,
Any disease run in your family?
no,
Any prescribed medication?
no, no.
Okay. Mr. Fadi, I want to ask you some question asked to all patient. Whom do you live with and where do you live?
I'm living with my family downtown.
What do you do for living?
I'm studying.
By any chance, did you smoke? Do you smoke?
No, no,
Drink alcohol?
no,
By any chance, do you use any illicit drug?
no, no,
Okay. What's your would you like to add anything, Mr. Fadi?
no, no.
Okay. What's your concern, Mr. Fadi?
What is the problem, doctor? Is it serious? Do I need any imaging, any surgery, any admission?
I appreciate your concern, Mr. Fadi. Have knee pain. Dr. Hani, you hear me? Hello?
Yes, doctor, we can hear you.
Because the headphone is disconnected. Sorry. According to your data, you have knee pain since 1 week, gradual worsening, increasing, and you have history of blood disease when you are young. According to this data, it could be a bleeding or blood or hemorrhage inside your knee. So we need to keep you in observation room, do complete physical examination, including your knee. We need to do also some blood tests, including infection screen, inflammatory marker, bleeding profile, and also we need to do X-ray and ultrasound for your knee. We can also do knee aspiration. Uh, After that, we'll wait for the result. If we find everything is normal and there is any abnormal thing, we can refer you to the knee clinic. If we find any abnormality in the investigation of the
Thank
X-ray,
you. Thank
we
you.
can.
Okay, 30 seconds.
If you find any abnormality, you can keep you under you can admit you under orthopedic doctor and under medical doctor. I think the problem is related to your blood disease when you are young, and we may need to give you medication after we identify the exact blood disease you have when you are young. Is it okay with you?
Okay, thank you. Thank you, Omar. Okay, well done. So the patient denied trauma, so it's not knee injury, right? The
Yes.
patient denied constitutional symptoms, so it's not malignancy and not metastasis. The patient denied hotness, redness in the knee, so it's not infection. The patient denied anything cause or worsen it. He did not mention improve with exercise or start at rest, so it's not inflammation, right?
Yes.
The patient denied any disease run in the family. For example, if you ask him any disease run in your family, if he said my mother or father has rheumatoid, so it could be inflammation. Okay. The
Yes.
patient said, for example, blood disease or even blood thinning medication. So this is the reason. Easy. Okay.
Yes.
So if the patient mentioned blood disease or in prescribed medicine, he said, for example, I'm using blood thinning medication, whatever, aspirin or warfarin or Lavix or anything like that. So it could be bleeding inside the joint. So you did very well. So according to your data, you have pain in the right knee, started 1 week ago, gradual, increasing. It's like pressure, and you don't have any hotness or redness in the knee. Then it could be, since you have blood disease, it could be bleeding inside the right knee joint. Excellent, you did that. So what you will do, I will keep you in observation room to complete physical examination, examine your knee and the other joints. And here you will do some blood test, including infection screen, inflammatory markers, blood blood profile because he has blood disease. So blood profile. Well done.
Yes.
What you will do else? Knee aspiration, but the patient has blood disease and risk of bleeding. You will do knee aspiration? Yes, but after correcting what?
After correcting the bleeding disorder.
The blood disorder. Excellent. Okay. So you can say, do you remember which type? Is it type A or type B? Whatever he said, yes or no. So you can say no worries. We will do a blood profile and accordingly we can correct the blood disease. Easy?
Yes.
Okay. Then we will send the blood for cross match and blood group, and you might need blood transfusion as well. Easy?
Yes. Yes.
Okay. So any hemophilia, most of the blood disease, whatever sickle cell disease or hemophilia or von Willebrand disease, any blood disease, most of them need blood transfusion. Blood transfusion. But this one may need blood transfusion plus factor 8 or 9. Okay? Okay. So, well done. Here, X-ray and ultrasound scan can diagnose also. So, you can refer the patient to blood doctor if the problem relevant to the blood profile. Clear? Not orthopedic,
Yes.
not bone doctor. Clear?
Yes. I said medical after.
Blood
Yes.
doctor. So you can say if we find the blood test is confirming uh, bleeding inside the joint and the blood profile is showing blood disease, hemophilia, then we can refer you after correcting the problem, we can refer you to the blood doctor. Well done. So I will give you 9 out of 10. Well done. Thank you.
Thank you.
So regarding the accuracy, 95%, skillfulness, 100%, you are very organized, and supportiveness, 100%, safety, 95%, so total 9 out of 10, well done. Next one, Nagla.
أيوة.
The next station, I think this is the last one. In the previous station, Omar, so don't forget to ask
Yes.
about limb problem first. Okay.
Before. Yes. I
So
asked already.
yes, but I mean after Socrates, you ask, for example, where is the site of the pain, right or left? He said, for example, right knee. Then you can say,
Yes.
if you compare this limb with other side, any change in blah blah blah. Clear?
Yes.
So start by limb, then musculoskeletal, then tenderness. This is my point, okay?
Yes. Yes. Okay.
So in knee problem or leg problem, you should ask about the side D and the side T. Side D
Okay.
and the side T. Why side? Because is it front or sides or back or all? For example, you can ask about the side. You can say, can you point at the side of the pain? Is it in the front, sides, or back or all? Easy.
Yes.
Even in the leg. Okay. This station. Nagla. So you start also with the limb problem. Easy.
Okay.
So, for example, you after Socrates, you can ask him, uh, where is the site? Is it right or left? Right, for example. Okay. Where is the site? Is it in the front of your leg, or
Okay.
sides, or back, or all? Easy.
Okay.
Maybe in the cuff only, in the back. Okay. Maybe in the all. Okay. So, according to the questions of review of systems, for example, any change in size, any change in color, any change in hair distribution, is it hard to touch? This will give you idea. This will give you idea about the diagnosis. If he said a change in size, it means DVT until proven otherwise. If he said swollen, DVT until proven otherwise. If he said red, DVT until proven otherwise. Clear? Okay. So how
Yes.
to differentiate between artery problem or vein problem? So if shrank, I mean wasting of muscles, cold and pale, loss of hair,
Ischemia.
so it could be artery. It means limb ischemia. The other way around. If he said swollen, red, hot to touch, and intact hair, so it could be DVT. Easy?
Mm. Mm.
Okay.
Okay.
So if he said I have temperature and only uh, localized, for example, he said this area only, not all the limb. Okay. And he said hot to touch. And I have temperature, it could be cellulitis. I mean infection. I don't care about the term cellulitis. I care about the term infection. So how to differentiate between infection and the DVT? DVT, the pain will be more in the calf. Clear?
Mm.
What else? All the limb red. All the limb. I mean from the knee to the ankle. So the leg. Okay. So all intact here and also the limb is swollen, red, hot to touch. So what is the difference? Diffuse. The cellulitis or infection, it will be localized. Clear?
Clear.
Okay. So the management plan, what you will do, examination from head to toe, examine the leg and all limbs. Okay. Right leg and other limbs. Then what you will do, you will do Doppler ultrasound scan for the arteries and the veins for both limbs, no problem. Then blood test inflammatory markers, infection screen, and blood profile as well. And you will manage
Did
accordingly. Okay.
mm.
You have 30 seconds and 6 seconds. Regarding the limb ischemia, you have 3 classes. How many classes?
3.
1, 2, 3. Number 2, 2 classes, A and B. I don't care about them, no problem. The most important, if the patient has the severity, if the patient has numbness weakness and the problem in sensation, it means a class 3, easy.
Mm.
If the patient has normal sensation, no weakness, no numbness, so it could be class A, class 1, sorry. Clear? What is the difference?
Mm.
Class 1, good or bad?
Good.
Class 3,
Bad.
class 3 amputation. So
Irritation.
class 3, don't do anything. Send the patient to vascular surgeon
Vascular.
for amputation. Don't waste the time. Don't give him blood thinning medication because blood thinning medication will cause perfusion or reperfusion. It will kill the patient. So if there is obstruction here, if there is obstruction in the vessels, and he has numbness, weakness, loss of sensation, it means dangerous. If you open the blood vessel, the toxins will spread to the brain and the heart, the patient will die. Easy?
Okay. Easy.
So if the patient has no numbness, no weakness, and a normal sensation, it means class 1. Class 1, no problem, you still have time. It means early stage. You can give him blood thinning medication like heparin. You can do Doppler ultrasound scan for the arteries and the veins. What else? You can do CT angiography for the vessels or for the artery. Okay. Then you can refer to surgery. This is the difference between both. Easy. So you can catch that from data? Yes. According to his answers. If he said, I have numbness. Yes. Do you have weakness? Yes. So you should think about what? Class
Class 1.
3. If the patient has
3, sorry.
numbness, weakness,
Three.
so class 3.
Weakness 3. Yeah.
So
3.
the questions of the limb give you idea if artery or vein or infection. Easy? Okay. The questions of numbness, weakness, it will give you idea about what?
+1 or 2 or 3.
Excellent. So severity, right?
Yeah.
So these questions, the brown one, it will give you idea about the diagnosis. But numbness,
CBT or
weakness, the severity. Easy?
severity. Yeah.
Okay. So you can do also ultrasound scan for the leg? Yes. Why? Ultrasound scan for the leg, it will show you infection or not. How? The ultrasound scan for the skin and the subcutaneous tissue. Easy? This will help you guys for the purpose of the exam and real practice as well. Okay, what else? X-ray? Yes. For what? For bone infection. So, osteomyelitis. So, X-ray for what? Bone infection. Ultrasound scan for what?
Skin.
Skin, subcutaneous tissue, infection.
Yes.
And the Doppler ultrasound for
For the
vessels,
veins.
for
Vessels, yeah.
arteries and the veins to check the pulsation if pulsatile or not. Easy?
Mhm.
If the vein or artery absent or not. Okay. So you have 30 seconds and 6 minutes.
Okay.
You can start.
Okay, yeah. Hello, my name is Dr. Najla. I'm an emergency registrar. May I confirm your name and age, please?
I'm Fadi, I'm 31.
Nice to meet you, Fadi. How can I help you?
I have leg pain, doctor.
Sorry to hear that. Are you in pain now?
No, the pain is improving at rest. I have no pain now.
Okay. You told me that you have pain in your leg. Can I take some history regarding your complaint? Okay. Can you tell me more about this pain, please,
Yes,
Mr.
the
Fadi?
problem started 1 month ago. The problem started gradual, increasing, worsening. I think it's on and off. If I am walking or doing exercise, I have pain in my leg. If I take rest, like now, I have no pain.
Mhm. So you told me that the pain started 1 month ago. It's started gradual and increasing and worsening, and it decreased by rest and increased by movement. Am I right?
Yes,
Can you tell me which leg, right
right,
or left?
right side.
Right leg. And which is the side? Is it the front or the back or the sides of the leg?
All the limb, from the knee to
All,
the ankle.
all the right limb from the knee to the ankle.
Yeah.
Okay. And if you are comparing the leg together, do you feel that there is change in the size of the leg?
Yes, I feel it's shrunk.
It's shrunk. And what about the color? Is there any change in the
Pale,
color?
pale.
Pale color.
Mhm.
Okay. And what about the if hotness or cold? Do you feel hot or cold on the limb itself?
I think a cold.
Cold. And what about the hair distribution? Do you think that there's change in the hair
Yes,
distribution of your
no
leg?
more hair in this limb.
Okay, sorry about that. Okay, and in the scale of 1 to 10, and 1 will be the maximum. If the pain increase with the movement, how can you scale the pain?
Like 5.
Like 5. Okay. And does this pain spread anywhere else in your body?
No.
No. Okay. Do you feel that you have any weakness,
No.
any numbness?
No.
Do you have headache,
No.
any loss of consciousness,
No.
any jerky movement,
No.
any vision problem?
No.
Do you have any chest pain,
No.
heart racing, Dizziness?
No, no,
Okay. Do you notice that you have any cough or shortness of breathing?
no,
Any do you feel that there's any voice in your breathing or chest?
no, no,
Any change in the bowel?
no,
Mm. Do you feel that you have any nausea or vomiting?
no,
Any change in your urine?
no,
Any skin changes elsewhere?
no,
Mhm. Do you notice that you have fever?
no,
Any night sweat?
no,
Any loss of weight?
no,
Loss of appetite?
no,
Any lumps and bumps in your body?
no,
Do you have any previous medical history?
no,
Any previous surgery?
no,
Mm. Do you have any allergies?
no,
Any disease run in your family?
no.
I am asking this person a question, but that's helping me in the diagnosis. Where do you live and with whom?
It's my family in downtown.
Okay, and what do you do for a living, Mr. Fadi?
I'm receptionist.
Mhm. Do you smoke?
No,
Do you drink alcohol?
no, no,
Sorry for this question. By any chance, are you taking any illicit drugs?
no.
Do you want to add anything, Mr. Fadi?
No.
Mhm. What's your concern except this limp? You told me that you have a cold in your limp and you feel that it's
Is it serious, doctor? Is it serious? Does it need imaging admission?
Mhm. According to the data that I have collected from you, Mr. Fadi, uh, because you don't have till now any weakness or numbness, till now we are the diagnosis is most likely that you have what is called limb ischemia, but it didn't reach to the level that it will cause this problem that you'll be worried about. You came in very early, and we will keep you on the observation room, and we will do for you examination for your whole body and mainly the right lower limb, and we'll do like vascular examination for the arteries and veins of your leg, and we will do some blood investigation, including full blood count, blood profile, liver functions, and inflammatory markers. And we will take it from there. Of course, you need to do some images regarding the legs, like an ultrasound, to check to what extent this ischemia or this decrease in the on the vein supply to your leg reaches with level. Are you following me, Mr. Fadi?
Okay, thank you. Thank you, Nagla. Your time done. You want to add anything?
I will try to refer you to the vascular team, and they will follow with us your condition, and we will take it from there. If you need any help, I will be around.
Okay, thank you. Thank you, Nagla. So the patient has pain on and off. If the pain on and off, it means the early stage, most likely easy.
Mm.
If the pain is
Easy, yeah.
continuous, it means critical. It means it could be class 3. Okay.
Mhm.
So
Mhm.
you will care about the diagnosis or the classification?
For the meantime, in this
Which you want
case,
to start, you will mention the diagnosis first or you will mention the classification first?
the classification,
No, diagnosis first.
diagnosis. Okay, okay,
The classification
okay,
for what? You did not mention the diagnosis. Okay.
okay.
So
Okay.
logic to talk
Uh-huh.
about the
After
diagnosis.
the diagnosis, then to tell him about
Yes.
okay,
Okay.
okay,
So you can
okay.
tell him, according to your data, you have leg pain in the right side, from the knee to the ankle, all the limb, okay? And started 1 month ago, on and off, increase with exercise and improve with rest or at rest. It could be problem in the artery. Easy.
Yes. Yeah.
It could be problem in the artery in
Mm.
the right leg, which is called in medical term limb ischemia. So in general,
Ischemia.
guys, mention non-medical terms, non-medical explanation, then followed by
Medical.
medical term. Easy.
Easy.
So mention the problem first, then you can go deep for the problem. For example, classification or whatever. Easy? Okay.
Easy.
Then you can say, since you don't have any problem like numbness or weakness, so it could be early stage. And
Mm.
this is good news. Clear?
Yes, clear.
Okay. For this reason, I will keep you in observation room, do complete physical examination, examine your limb and the other limbs. Okay. Right leg and other limbs. Okay. What do you need in examination? How to diagnose? You will examine the vessels. Easy.
Yeah.
How
Mm.
to catch the classification? You will examine the nerves. Clear?
Mm.
So the vessels to catch the diagnosis, the nerves
And
to catch the
the nurse
classification.
classification. Yeah.
So you can say, I need to examine the arteries and the veins in your leg, right leg, then the nerves to check the severity or the classification. Easy.
Mm. Easy. Yeah.
So
Yeah.
when you explain, start by diagnosis, then severity.
Classification. Yeah.
Even the examination, diagnosis, then severity. Okay.
Mm.
Then imaging. I need to do some imaging. You will do 3 imaging. 1 ultrasound scan. Number 2 Doppler ultrasound scan. Number 3 X-ray. Clear?
X-ray. Yeah.
So again, 1 ultrasound scan for the skin and the subcutaneous tissue. Which one to start first? The Doppler or the ultrasound scan?
Ultrasound.
Doppler. Because the diagnosis
With
is
a
limb ischemia. Diagnosis is limb ischemia. So you can say, I will do Doppler ultrasound scan for the arteries and the veins in your leg to confirm limb ischemia. Okay? Then
Mm.
I need to do ultrasound scan for the skin and the subcutaneous tissue to rule out any infection. I need to do what else?
X-ray.
X-ray to rule out any infection in the bones. Okay.
Mm.
To be
Okay.
honest, this is more helpful in DVT, not in limb ischemia. Because in DVT, it's red, hot, swollen, so you are afraid of infection. But if the patient has shrank, cold, pale, unlikely to be infection. Easy,
Yeah.
but it's a general management. You can fix whatever artery or vein or cellulitis. Okay. By this way, you can say, so it could be early stage of limb ischemia. For this reason, I will give you blood thinning medication. You did not mention blood thinning medication. I will give
Yeah.
you blood thinning medication, which is called in medical term heparin. And if you have if you have no contraindication, and I will do specific imaging, which is called CT angiography. CT angiography for the arteries in your leg to see the blood clot in your leg artery. Clear?
Clear.
Okay.
Yeah.
Then I will refer you to vascular surgery. Okay. Or you can say surgery team, the specialty vascular. Okay. Until now, you are on safe side. Okay. So I will give
Okay.
you 8 out of 10. Okay.
Thank you.
So I think this is the last station for today. So accuracy 90%, skillfulness 100%, efficiency structure 100%, supportiveness 100%, and the safety 90%. So 8 out of 10. Okay. Well done. Thank you, guys. I think we did well today. I wish if you prepare for next session. So just work on wording, work on questions, work on memorization. If you have good memorization, you will be free for extra information. Clear, guys?
Yes.
If you have good memorization of the general approach, you will be ready for any extra information. So if I give you any extra information for each station, you will absorb very easily. Okay? Anyone has any question,
Yes.
guys?
Thank you.
Thank you, guys. Bye-bye. So our schedule as usual, Saturday, Monday, Wednesday. I am waiting for Monday, 4 p.m. UK time. Thank you. Bye-bye.
Thank you.
Thank
Thank
you.
you, sir.